the Centers for Disease Control, or the CDC, has said it's going to block messaging used by overdose prevention groups across the US. And basically, this is an idea of harm reduction where you're not necessarily going to be able to stop people taking drugs. So what you try to do is you try to get them to take them more safely to save their lives and also to reduce the burden on hospitals and emergency responders. But the CDC is now saying that you're not allowed to use that messaging if you have any kind of state funding. So there were more attacks on vaccines as well in the last couple of weeks. So Kurt Malone, who's a paediatric cardiologist and is the RFK Jr. PIC chair of the Advisory Committee on Immunization and Practices, shortened to ACIP, he was in a podcast and he basically said, do we really need polio vaccination? And also questioned the other kind of long-standing diseases that have been vaccinated against in childhood for decades. Now, the reason that is so worrying is because polio is not yet extinct in the world. There are still reservoirs of it. It is very infectious. The eradication of polio from almost all countries in the world has been one of the major public health successes of the last century. I mean, it used to kill and permanently maim tens of thousands of children. And we have a really effective vaccine. It's a very safe vaccine. And just making sure that everyone stays vaccinated is a way of making sure that it can never come back. And he's now questioning that. We also know that the administration has been attacking the measles vaccine, that it hasn't been supportive of it, that it's been quite kind of unconcerned about the quite large measles outbreaks that have happened in the US over the last year. And they kind of talked about it as inevitable. It isn't inevitable, right? Measles was declared eliminated in the US only about 20 years ago. And basically now officially America has lost its status of having eliminated measles. You think that the Centre for Disease Control and Prevention would care about that. It's literally in its core purpose. But the principal deputy director said the other day that he doesn't view the loss of the country's measles elimination status as a significant event and that it was just the cost of doing business. So on the 22nd of January, the United States formally withdrew from the World Health Organization. And that basically makes good on the executive order that Trump issued on his very first day of office a year ago. But the US isn't leaving with its bills paid. WHO officials have said that the US has failed to pay its membership fees for both 2024 and 2025, and basically it owes $280 million to the WHO. The US says it's not going to pay. The WHO says the withdrawal isn't complete until the US does pay, but nonetheless, I think it's an alliance that is well and truly dead, and both the United States and the World Health Organization are the worse for it.